So I think for people who are seeking a healthy life, the lowest risk possible of chronic diseases, cardiovascular disease, type 2 diabetes, cancer, cognitive decline, the focus really should be on healthy diet and healthy lifestyle. And this includes having a diet that is predominantly plant-based, does not need to be vegetarian or vegan, but predominantly plant-based, lots of fruits and vegetables and whole grains, whole foods, fish, trying to really minimize processed foods, red meats, processed meats, that type of diet, more of a Mediterranean type dietary pattern, unsaturated fats emphasized over saturated fats, or the DASH diet, high in fruits and vegetables. That is the type of diet that's been linked in many studies to a longer life. Also, regular physical activity. I cannot stress that enough. And this includes both the aerobic exercise, even brisk walking, jogging, tennis, racket sports, being physically active with both aerobic activities and with some strength training, resistance training, some muscle strengthening exercises such as elastic bands or free weights or various activities that are more resistance based. This is what is so important for healthy life, prevention of chronic disease. Now, what is the role of dietary supplements? Um, if there are reasons that you think you cannot get enough of the vitamin D, or let's say you have lactose intolerance and you cannot have any of these fortified dairy products, you may want to take a supplement. Let's say you have osteoporosis or you're in a facility, nursing facility, whatever, where your diet is restricted. You can't have time outdoors, or you have Crohn's disease or celiac disease, and you're worried about absorption of vitamins and minerals. That's when, a supplement would be a benefit. You don't eat fish at all, you don't get the marine omega-3s, that's when, fish oil or, omega-3 supplement would be needed. If you have macular degeneration, look for these formulations that are intended, for people with macular degeneration because they've been well tested and shown to, slow the progression of the disease. Again, people with bone health problems, if they have osteoporosis, they're being treated with medications for osteoporosis, that's where these supplements are worthwhile. Now, is there a role in a healthy individual without any of those indications for taking vitamin D, omega-3s, multivitamins? I think, with multivitamins, because the prior research suggested at least a small reduction in cancer, total invasive cancer, and these recent findings are suggesting that there are benefits for age-related memory loss, cognition, and even a study has been reported at a conference that multivitamins may slow biological aging, such as these epigenetic clocks. I think it's getting to a point where professional organizations that write the guidelines should seriously consider recommending a multivitamin for older adults, even midlife, for these benefits that have now been seen in many of the randomized trials. I think someone who wants, as a form of insurance, to hedge their bets to take a multivitamin, I think it is extremely reasonable. It's very safe. All of our trials and other trials of multivitamins have shown that even long-term use with multivitamins is very safe. And there were some benefits of the cocoa extract as well. But, overall, I think that most of these supplements are not needed. There may be a role as a form of insurance for multivitamins, vitamin D for the various scenarios we just discussed, and omega-3s if you don't eat fish at all, you have very low fish consumption. I think it's worth discussing with your healthcare provider. If you have multiple risk factors for cardiovascular disease, you may want to discuss it. But for the most part, there are so many other dietary supplements on the market that are not well tested and have not been shown to have clear benefits in randomized trials and may even have toxicities and side effects when taken in high doses, I would not recommend most of the dietary supplements that are on the market.